Thank you very much for giving us this opportunity. I am I'm Irish, and when I was a child, I had some very extreme experiences of gender, and as a result, I'm very interested in the different conversion therapy bands that have arisen around the world because my own experience shaped my understanding of how gender can change. I wanted to be a boy. I kind of lived like a boy for many years, from as far back as I could go. So it's around about 3, and it went on for many years. And I was very good at being a boy, and I was the only kid in the school who wore trousers. Like, there was girls and boys in the school. The girls wore skirts because we had uniforms. The boys wore trousers. I wore trousers. So I was accepted as a boy in a very 1980s kind of fashion. And I'm glad I was. I'm glad I had that freedom to be who I was, and nobody was kind of shaping me. I now know the statistics, and I know that 80% of kids like me do grow out of what gender dysphoria, what it's called now, and they go on to be like me, comfortable in their own skin. For me, puberty was very, very difficult. It was a very, very difficult experience. It caused me an awful lot of pain, but ultimately I came out of it, I came through it, and I ended up marrying, having children, and not being impacted by any sort of medicalization of my gender identity. And I became a psychotherapist in my 30s. And I've written a few books. I've written a few books on parenting and on families and on mental health. And they've been published in the last few years. And I wrote an article about my experiences because I noticed how gender was becoming very heightened in just in the world in general. So I wrote my own experiences, and as a result, I was asked to do a film for Channel 4 in the UK about my experiences. And the premise of the film was, of the 4,000% rise of girls seeking to medically transition, and they are the numbers, could any of them be like me? Could any of them grow out of gender issues? Because there seems to be an awful lot of room for people to medicalize their gender, but there isn't very much room for people to grow out of their gender. And so that was the premise of the film, and it was released in 2018. And we got a huge amount of responses, and a huge amount of people contacted me. And as a result, I've started working a lot in the field of gender, and I've started working a lot with parents who have been impacted. And we started with the GDSN, that's the Gender Dysphoria Support Network. It was very much a COVID story because we started running kind of Zoom, kind of therapeutic support meetings for parents. And these were parents who were unhappy with the medical treatment that their children were getting. These were parents who felt that their children had issues such as Asperger's, autism, ADHD, OCD, depression, anxiety, eating disorders. And these diagnoses weren't being taken into account when the child was also diagnosed with gender dysphoria. And that felt disproportionate, and it felt unfair because the parents know their children mostly more than anybody else. Most parents care about their children more than anybody else. And yet we found very quickly with the GDSN, first we had 1 meeting a week, then 2 meetings a week. Very quickly it turned into 5 meetings a week because so many parents were coming to us, and they were all saying the same thing. They were saying 2 things. My child has lots of other diagnoses that are being ignored, and I'm not happy that my child is getting the appropriate psychological support that they need. They're vulnerable, they're distressed, and they need the doctors to go slowly. They need the doctors to hasten slowly. They need the doctors to first do no harm, and they need a soft, psychological, compassionate approach before we rush to medicalize this situation. As a result of the extraordinary influx of parents into the GDSN, I formed GenSpect, and this is why I'm here tonight. Well, tonight here, this morning for you. And GenSpect represents over 16 organizations from 14 different countries. And all of these organizations are all saying the same thing. So we're representing thousands of parents who are all saying our children are being rushed to a medicalized identity. And why can't they live a gender expansive life? Why can't boys wear dresses? Why can't boys wear makeup? Why can't we kind of start becoming a little bit more expansive in our understanding of gender rather than medicalizing the situation? No more than that, a lot of parents are saying that I think my child has got internalized homophobia. I think my child is actually a lesbian. She doesn't want to be a lesbian, and she's repressing her sexuality. And what she's doing is she's repressing her sexuality and saying that she's a boy. My point is, we don't know what is the reason for this extraordinary rush and this extraordinary escalation in the numbers. We don't know. Nobody knows, because the numbers are very quickly growing very fast. And what I'm urging your committee to think about is, well, when you're in a situation where you don't actually know the facts, when the numbers are very, very quickly escalating, and when actually the doctors, there is no consensus, when the doctors are starting to contradict themselves, I want to remind people that WPATH is considered the gold standard of transgender care. It's always the people who are very pro, very quick transition, always look to WPATH. And yet 3 main players, the president-elect of WPATH came out last week, Dr. Marcy Bowers, and said she was concerned that people were going from puberty blockers to cross-sex hormones, and it was becoming problematic. I see you've got your hand up. Do you want to ask me a question?
No, I think Lewis does have a question, if that's right, and Simon as well. But did you want to finish off?
Yeah, I would. I'd just like to finish off just these last 2 sentences. One, that Marcy Bowers, president-elect of WPATH, cautioned. She said, we need to slow down. It's going too fast, too quickly, and there seems to be some sort of social contagion. At the very same time, Laura Edwards-Leeper, who's the chair of the Adolescents and the Child Committee of WPATH, again, a very pro-transitioning organization, she said that there isn't a suicide risk, that it has been overblown, that this has become a kind of an overstated fear. What we need actually is compassionate psychotherapy. When people are in high distress, you don't rush to medicalize. What you rush to do is make sure that they have the appropriate mental health support. And it's really important that the committee realizes that the law is very often behind medical. The law is very often behind everything, because the law follows society. And Finland have rowed back on their very heavy pro-transition. Sweden have rowed back. All but one of the Swedish pediatric gender clinics now don't recommend puberty blockers. Why? Because they're realizing they have caused more problems than they sought to resolve. The point I'm saying, I know I'm going into quite a lot of detail, the point I'm saying is, when something is very fast and it's moving very quickly and the numbers are growing very fast, you should go slowly and make sure that we're the adults in the room, and we're doing things carefully and with caution.
Thank you very much.
Thanks.
Lewis, I think you had your hand up first.
Yeah, kia ora, Stella. Thank you very much for participating in our process here in Aotearoa, New Zealand. You referenced more the female to male transition. I just want to quote from a New Zealand Medical Journal article, and it was specifically endocrine services in the Wellington region here in New Zealand. But it seems to me historically there's always been a disproportionate number of men who want to transition to female. Yeah. But what this piece of research indicates actually is that the female to male is now equaling the demand for male to female. So in fact, there isn't an issue, and that service has increased, but that's because historically it was much easier for men to transition to female as opposed to females transition to male. Is that the same? Is that what you've seen? Because you haven't really talked about the...
I'd love to respond to that. What I would say is that there's quite a lot of literature in the past, right up until the last 10 years, where there was 2 very main cohorts that were seeking to transition or seeking to be the opposite sex. That was young boys and middle-aged men. And they were the 2 groups. Now, suddenly, out of nowhere, in the last 10 years, there's been a rise in adolescent girls. So these are 3 very extreme changes. They're very different cohorts. And what I would be very concerned about, if it was a rebalancing, a recalibrating of the numbers, that all these girls had always been suppressed, which I don't really agree with, because I think it's easier for a girl to transition because she passes easier. And there's a lot fewer kind of challenges physically because she can pass when you transition from female to male. The thing is, though, that there isn't a recalibration among the middle-aged women. And so why is there all these adolescent girls who are transitioning, and yet there isn't a similar kind of onslaught among the middle-aged women? It doesn't quite make sense. I do want to say that I work for the IATDD, which is the International Association for Therapists for Detransitioners and Desisters, and that is very heavily populated with girls who are detransitioning. So the girls are seeking to transition in very high numbers, and they're detransitioning in high numbers. And the studies of the detransitioners is only yet to come out. But when I first started following Detrans Reddit, there was less than 1,000 people on Detrans Reddit. And I urge you to read Detrans Reddit. That's what it's called, Detrans Reddit. And there's over 22,000 now, 22,000 people on Detrans Reddit now. A couple of years ago, there was 1,000.
Can I just point out one other point? Because what you're doing isn't conversion practice. What you're doing is psychotherapy. And it equates to the Royal Australasian and New Zealand College of Psychiatrists, who have put out a very clear statement that we have to address the mental health needs before we address the gender dysphoria.
Couldn't
so
agree
you
more.
wouldn't be captured by the legislation.
Yeah, I'm very against conversion therapy. What?
That's a completely erroneous interpretation of the law by Lewis Wall. Would, on the plain words of this bill, what you were doing would be captured by the bill.
No,
Absolutely.
no way.
It would. And I don't, you know, we could argue this. Stop putting your contestable view of what the law says with zero legal expertise in front of the committee, Lewissa. I've got a question for you, Stella, because I think what you said was very common sense, albeit I'm sure by saying that I'm downplaying the expertise and experience you have. What the bill does, in the words of Section 4, Clause 5, is it criminalises, quote, suppressing individuals' sexual orientation, gender identity, and gender expression. The problem is, it seems to me, those aren't static or immutable. And I take it that's a point you agree with. I
do. I think we need to divide it. I think, you know, the abhorrent practices of people trying to convert people who were gay were horrible, and they were awful, and they happened back in the past much more often. I'm not sure I know no ethical therapist is going to try to convert anybody from their sexual orientation, because it wouldn't be appropriate and it wouldn't work, because sexual orientation maintains. The thing about gender identity is it can come out very strong, as it did for me as a child. It can go. It can come out in adolescence. It can go. It can change. You can go from being trans woman to being non-binary. So it's very much a moving kind of feast. And therefore, why would we create one landing place by medicalising one identity when that identity could be in a state of flux? When do we know whether this identity is going to move or not? And when is exploratory, compassionate, ethical therapy considered conversion therapy? I want to really caution people that this has to be an appropriately worded document, because if somebody has internalized homophobia, and if you're a therapist and you encourage them to seek out medical transition, and they later on come to me because I'm in the IATDD and I work with detransitioners, and they say, my therapist convinced me to medically transition, and frankly, I had a repressed sexuality, I was lesbian, and I hated the fact I was lesbian, and I transitioned as a result. Well, where are we now? We're in really difficult, complicated waters, because you've conflated two very different things, which is gender identity and sexual orientation, and then frankly thrown in gender expression, which is kind of nothing to do with anything. I really think that's just a suggestion to me that this is a badly worded bill.
And so if what the bill does, and I appreciate the different views of it, but I have a very clear view that it does, if the bill criminalises a parent telling a child that they should not go on puberty blockers, would that be something you would be concerned about?
I'd be very concerned about it, because puberty blockers are an experiment. They're about 10 years in and they're not going well. The poster child for puberty blockers is Jazz Jennings. She took puberty blockers. She was the first American kind of trans kid and the first well-known in the media. And then it turned out when she wanted to transition, when she was about 18, she didn't have enough tissue. She didn't have enough penile tissue to create the neo-vagina that they wanted. And therefore, the very solution, which was puberty blockers, were the actual cause of the problem. And you may even remember I mentioned Dr. Marcy Bowers. Dr. Marcy Bowers was her surgeon. And there's been 4 operations and counting with Jazz Jennings, because it hasn't worked out, because the puberty blockers prevented there to be enough tissue. So puberty blockers don't seem to have any sort of merit. They were an experiment. People thought, we'll see how this works. It hasn't worked out well, because frankly, the gold standard, the people who were supposed to be so pro it, are now rowing back. Finland have rowed back, Sweden have rowed back. The UK
Stella,
has been
I'm sorry, I'm just going to have
Sorry.
to pause you there because we're at 15 minutes. So
Yes.
we have it's fascinating. So really great discussion, and I think some good.
I'm Irish, so I'm very chatty.
But we've got someone else who's waiting to submit, so I just need to move things along if that's okay.
My
Thank you very
apologies.
much. Great.
Thank you.